Hello YouTube! Today I'm going to be reading about schizophrenia, since I personally have schizophrenia, and because it's a pretty interesting topic. It says, schizophrenia is a mental disorder characterized by a breakdown of thought processes and by a deficit of typical emotional responses. Common symptoms include auditory hallucination, paranoid or bizarre delusions, or disorganized speech and thinking, and it is accompanied by significant social or occupational dysfunction. The onset of symptoms typically occurs in young adulthood, with a global lifetime prevalence of about 0.3 to 0.7%. Diagnosis is based on observed behavior, and the patient's reported experiences. Genetics, early environmental, neurobiology, and psychological and social processes appear to be important contributory factors. Some recreational and prescription drugs appear to cause or worsen symptoms. Current research is focused on the role of neurobiology. Although no single isolated organic cause has been found, the many possible combinations of symptoms have triggered debate about whether the diagnosis represents a single disorder or a number of discrete syndromes. Despite the etymology of the term from the Greek roots schizin, to split, and phren, mind, schizophrenia does not imply a split personality or multiple personality disorder, which is known these days as dissociative identity disorder, a condition with which it is often confused in public perception. Rather, the term means a splitting of mental functions because of the symptomatic presentation of the illness. The mainstay of treatment is antipsychotic medication, which primarily suppresses dopamine and sometimes serotonin receptor activity. Psychotherapy and vocational and social rehabilitation are also important in treatment. In more serious cases, where there is risk to self and others, voluntary hospitalization may be necessary, although hospital stays are now shorter and less frequent than they once were. The disorder is thought mainly to affect cognition, but it also usually contributes to chronic problems with behavior and emotion. People with schizophrenia are likely to have additional conditions, including major depression and anxiety disorder. The lifetime occurrence of substance use disorder is almost 50%. Social problems such as long-term unemployment, poverty, and homelessness are common. The average life expectancy of people with disorder is 12 to 15 years less than those without, the result of increased physical health problems and a higher suicide rate, about 5%. Symptoms. A person diagnosed with schizophrenia may experience hallucinations. Most reported are hearing voices, delusions, often bizarre, persecutory in nature, and disorganized thinking and speech. The latter may range from loss of train of thought to sentences only loosely connected in meaning, to incoherence known as word salad in severe cases. Social withdrawal, sloppiness of dress and hygiene, and loss of motivation and judgment are all common in schizophrenia. There is often an observable pattern of emotional difficulty. For example, lack of responsiveness, impairment in social cognition is associated with schizophrenia, as are symptoms of paranoia. Social isolation commonly occurs. Difficulties in working and long-term memory, attention, executive functioning, and speed of processing is also commonly occur. In one uncommon subtype, the person may be largely mute, remain motionless in bizarre postures, or exhibit purposeless agitation. All signs of catatonia. About 30% to 50% of people with schizophrenia do not have insight. In other words, they do not accept their condition or its treatment. Treatment may have some effect. Schneiderian classification. In the early 20th century, The psychiatrist Kurt Schneider listed the forms of psychotic symptoms that he thought distinguished schizophrenia from other psychotic disorders. These are called first-rank symptoms, or Schneider's first-rank symptoms. They include delusions of being controlled by an external force, the belief that thoughts are being inserted into or withdrawn from one's subconscious mind, the belief that one's thoughts are being broadcast to other people, and hearing hallucinatory voices that comment on one's thoughts or actions, or that have a conversation with the hallucinated voices. Although they have significantly contributed to the current diagnostic criteria, the specificity of first-rank symptoms has been questioned. A review of the diagnostic studies conducted between 1970 and 2005 found that they allow neither a reconfirmation nor a rejection of Schneider's claims, and suggested that first-rank symptoms should be de-emphasized in future revisions of diagnostic systems. Positive and negative symptoms. Schizophrenia is often described in terms of positive and negative symptoms. Positive symptoms are those that most individuals do not normally experience but are present in people with schizophrenia. They can include delusions, disordered thoughts and speech, and tactile, auditory, visual, olfactory, and gustatory hallucinations, typically regarded as manifestations of psychosis. Hallucinations are also typically related to the content of the delusional theme. The positive symptoms generally respond well to medication. Negative symptoms are deficits of normal emotional responses or of other thought processes and respond less well to medication. They commonly include flat or blunted affect and emotion, poverty of speech, alogia, inability to experience pleasure, anhedonia, lack of desire to form relationships, asociality, and lack of motivation, avolition. Research suggests that negative symptoms contribute more to poor quality of life, functional disability, and the burden on others to do positive symptoms. People with prominent negative symptoms often have a history of poor adjustment before the onset of illness, and response to medication is often limited. Onset. Late adolescence and early adulthood are peak periods for the onset of schizophrenia. Critical years in young adult social and vocational development. 40% of men and 23% of women diagnosed with schizophrenia, the condition manifested itself before the age of 19. To minimize the developmental disruption associated with schizophrenia, much work has recently been done to identify and treat the prodromal pre-onset phase of the illness, which has been detected up to 30 months before the onset of symptoms. Those who go on to develop schizophrenia may experience transient or self-limiting psychotic symptoms and the non-specific symptoms of social withdrawal, irritability, dysphoria, and clumsiness during the prodromal phase. Causes. A combination of genetic and environmental factors play a role in the development of schizophrenia. People with a family history of schizophrenia who suffer a transient psychosis have a 20 to 40% chance of being diagnosed 1 year later. So that's just a little bit about schizophrenia that I read off of Wikipedia. Since I have schizophrenia, I thought it would be pretty good to talk about it. I don't really have auditory hallucinations or visual hallucinations though. I think mine is just disordered thought processes or conversation or something like that. Yeah, I take medicine for it. I take Zyprexa currently, which made me gain weight. I weigh like 190 pounds now. Yeah, I don't know. I wonder if my kids will ever see this video, or if it maybe help them in some way. If I do have kids. Well, it's getting to be 10 minutes, so I'm going to go ahead and stop this video. It was nice making another video. Sorry for not having more videos lately. I haven't been making that many videos. good one.